So family members are really important in supporting people along their health pathways. A lot of the time we're going to recommend some dietary changes that may need to be implemented. Cutting out some foods that a lot of people are comfortable with and have been eating for a long time, and their family eats as well. So making these changes, it's really nice to have your family support you along that way and make these changes with you. So you're not the only one sitting at the table eating a kale salad while the rest of your family is having burgers.
Sometimes the family members are the ones who are doing the cooking or the food preparation for patients. So it's very helpful to have them there as part of the visit, so that while I'm explaining to the patient what they need to do for their diet, the family member is also there hearing that information. And oftentimes it helps if the whole family gets on board with whatever diet changes are needed, especially when we're dealing with children. I find that's always a challenge. So if we're working with a child who, say, is dealing with some skin disorder or some behavioral disorders, one of the tests we often will do is look at their food sensitivities and investigate if there may be some foods that are part of their diet at present that could be triggering a number of reactions that lead to behavior disorders or digestive disturbances or skin reactions, whatever the case may be. So for kids, we want to make sure that they're not feeling isolated in the dietary approach. And it helps if the entire family is on board with that. It makes for a higher probability of the child adhering to the diet and greater success overall.